Hi there, I'm Tiffany Wuebben, and I'm thrilled to have you join me today as we continue exploring ways to elevate our dental hygiene departments. Today, we're focusing on a topic that could truly transform the way your practice operates: developing standardized hygiene protocols. Now, I know protocols might not sound super thrilling on the surface, but trust me, these are the backbone of providing consistent, high-quality patient care. And when you get them right, they don't just help your patients, they make your day-to-day workflow smoother than ever. First, let's talk about why protocols are such a big deal. Picture this: you're managing a full schedule of patients, and each one presents with different needs. Without clear guidelines for how to assess and care for those patients, things can feel chaotic. Standardized hygiene protocols create a roadmap that takes the guesswork out of patient care. They ensure everyone on your team is on the same page, which means less stress for you and a better experience for your patients. Now, how do you go about creating these protocols? Well, you're going to start with patient assessment flowcharts. These are the visual tools that outline the step-by-step process for evaluating patients during their visits. For example, the flow chart might include steps for checking medical history, performing periodontal probings, documenting findings, and recommending next steps. Think of it as your playbook. It's there to guide you and help maintain consistency no matter who's performing the assessment, and that's huge. Once you have an assessment framework in place, it's time to focus on care plans. This is where customization is key. Not all patients fit neatly in the same treatment bucket. Protocols should include detailed care plans tailored to the different AAP periodontal stages. By creating specific steps for each stage, you not only make patient care more efficient, but also ensure you're meeting each patient's needs very unique. For instance, patients with mild periodontitis might require more frequent cleanings and periodontal maintenance, while those with advanced can require different needs, like maybe a referral to the specialist. The beauty of standardizing hygiene protocols is that they set the stage for consistency while still allowing room for professional judgment. You're not locked into a rigid system. You're creating a reliable foundation that gives your team the flexibility to adapt as needed. And when everyone follows these protocols, it enhances patient care. Patients receive the right treatments at the right time, and they see that your team is consistent and trustworthy. Over time, this builds loyalty and trust in your practice. But the benefits don't stop there. Standardized protocols also streamline your practice's operations. Think about it. When every hygienist and dentist follows the same guidelines, your team works more efficiently. You avoid unnecessary back and forth discussions about what's next for the patient because everyone is on the same page. Plus, it makes onboarding new team members a breeze. With protocols in place, new hires can quickly integrate into your workflows, which reduces stress and keeps your practice running smoothly. Before we wrap up, here are the key takeaways. Having well-defined hygiene protocols isn't just about creating structure. It's about delivering better care, reducing stress, and setting your team up for success. Start by developing patient assessment flowcharts to guide your evaluations. Customize care plans for different periodontal stages to meet your patient's unique needs. And remember, protocols are there to enhance teamwork and consistency, which ultimately leads to better patient outcomes and a more efficient practice. If you haven't done it already, I encourage you to start developing your hygiene protocols that align with your mission statement. Use your mission statement as the guiding principle. What kind of care do you want to deliver, and how those protocols can support those goals? This is your opportunity to create a system that empowers your team and provides exceptional care for every patient who walks through your door. Thank you so much for joining me today. Developing protocols may take some effort up front, but the payoff is absolutely worth it. You're building a foundation that supports not just your team, but the health and trust of your patients. Keep up the amazing work, and I'll see you in the next session.